Lornoxicam is a non-steroidal anti-inflammatory drug and SAID with analgesic pain-relieving and anti-inflammatory properties. Here are some key points about its pharmacology. 1. Mechanism of action. Lornoxicam works by inhibiting enzymes called cyclooxygenases COX1 and COX2, which are involved in the production of prostaglandins. Prostaglandins play a role in inflammation, pain, and fever. By blocking COX enzymes, Lornoxicam reduces the production of prostaglandins, leading to pain relief and anti-inflammatory effects. 2. Absorption. Lornoxicam is well absorbed when taken orally, and it can also be administered intravenously or intramuscularly. 3. Metabolism. Lornoxicam undergoes extensive metabolism in the liver, primarily through oxidation and conjugation reactions. The primary metabolite is 5-hydroxylornoxicam. 4. Elimination. The elimination half-life of Lornoxicam is approximately 4 to 5 hours. It is primarily excreted in the urine, with a small portion eliminated in the feces. 5. Indications. Lornoxicam is used to relieve pain and inflammation in various conditions such as osteoarthritis, rheumatoid arthritis, acute musculoskeletal disorders, and postoperative pain. 6. Analgesic and anti-inflammatory effects. Lornoxicam provides pain relief by reducing inflammation at the site of injury or inflammation, and by blocking pain signals in the central nervous system. 7. Selectivity. Lornoxicam is considered a preferential COX2 inhibitor, which means it has a somewhat higher selectivity for inhibiting COX2 over COX1. This selectivity may result in a reduced risk of gastrointestinal side effects compared to some other NSAIDs. For pain and inflammation, the usual starting dose for adults is typically 4 milligrams once daily. Your doctor may adjust the dose based on the severity of your pain and your individual response to the medication. In some cases, a higher initial dose of 8 milligrams may be prescribed. For osteoarthritis and rheumatoid arthritis, the typical recommended dose is 4 milligrams to 8 milligrams once daily. Your doctor will determine the appropriate dose based on your condition. Lornoxicam, like other non-steroidal anti-inflammatory drugs and SAIDs, can have various side effects. While not everyone will experience these side effects, here are some of the most common ones associated with Lornoxicam. 1. Gastrointestinal effects, stomach pain or discomfort, nausea, indigestion, diarrhea. Gastric ulcers less common, but more serious. 2. Central nervous system effects, headache, dizziness, fatigue. 3. Skin reactions, rash, itching. 4. Cardiovascular effects, increased blood pressure, hypertension, fluid retention, edema. 5. Renal effects, impaired kidney function in some cases, particularly with long-term use or in individuals with pre-existing kidney problems. 6. Hematological effects, changes in blood cell count, e.g. anemia, decreased platelet count. 7. Allergic reactions. Rarely, Lornoxicam can cause severe allergic reactions, such as skin rash, swelling of the face, lips, or tongue, and difficulty breathing. Seek immediate medical attention if you experience these symptoms. Lornoxicam, like other non-steroidal anti-inflammatory drugs and SAIDs, can interact with various medications, potentially leading to altered effectiveness or increased risk of side effects. Here are some common drug interactions to be aware of. 1. Other NSAIDs. Taking multiple NSAIDs together can increase the risk of gastrointestinal side effects and bleeding. Avoid using Lornoxicam with other NSAIDs unless specifically directed by a healthcare provider. 2. Anticoagulants, blood thinners. Combining Lornoxicam with anticoagulant medications like warfarin or direct oral anticoagulants, DOACs, can increase the risk of bleeding. Your doctor will carefully monitor your condition if you need both types of medications. 3. Antiplatelet drugs, medications like aspirin and clopidogrel, which reduce platelet aggregation and the risk of blood clots, can also interact with Lornoxicam, increasing the risk of bleeding. 4. Corticosteroids. Concurrent use of Lornoxicam with corticosteroids may increase the risk of gastrointestinal ulcers, and bleeding. 5. ACE inhibitors and diuretics. These medications are commonly used to manage high blood pressure and heart conditions. When taken with Lornoxicam, they may reduce the blood pressure-lowering effects of ACE inhibitors and diuretics. 6. Lithium. Lornoxicam may increase lithium levels in the blood, potentially leading to lithium toxicity. Close monitoring of lithium levels and adjustment of dosage may be necessary if you are taking both medications. 7. Methotrexate. Lornoxicam can increase the levels of methotrexate in the blood, potentially increasing the risk of methotrexate-related side effects. Your healthcare provider will carefully monitor you if you are taking both drugs. 8. Selective serotonin reuptake inhibitors SSRIs and serotonin norepinephrine reuptake inhibitors SNRIs. Combining Lornoxicam with these antidepressant medications may increase the risk of bleeding, particularly in the gastrointestinal tract. 9. Cyclosporine and tacrolimus. These immunosuppressive drugs used in transplant patients may have their blood levels increased. When taken with Lornoxicam, close monitoring and potential dose adjustments may be necessary.